unique episode of the Community Pharmacy Accelerator Show. And today, of course, yours truly, Pharmacist Joseph Aaron, the lead management consultant, PGNB's consult. And I'm really super excited to be with you today. And trust me, it's also another unique opportunity to learn and to equip yourself better to run your community pharmacy practice. And of course, here our goal is to make this practice fulfilling and to make it profitable and to give you a reason to enjoy practicing community pharmacy. So today we'll be talking about getting the best out of our healthcare assistants. All right. And from the description of this presentation tonight, you can see that the purpose is in dual capacity. One, we want the employer to maximize the presence of the healthcare assistants, who are not pharmacists, but, have a great value to offer if only you can bring out their areas of strength, right? And we want the healthcare assistant who has, a glimpse or who lays his or her hands on this presentation to be able to, get the knowledge to be equipped to become the best staff. All right. So we'll dive right into this presentation. So you want to ask, who really is the healthcare assistant in the community pharmacy, right? So in the community pharmacy, the healthcare assistant, whether you call them the auxiliary nurse or you call them the pharmacy assistant, we are talking about the same thing. All right. And we're talking about a very important member of the team. We're talking about the foot soldier, right? The healthcare assistants are the foot soldiers. Most times, they of course make up the bulk of our staff strength. Usually, we have one or two pharmacists, but we usually have more of them in the pharmacy, and they often alternate their shifts. Some do morning, some do evening. All right. So you can agree with me that they are always there, and they are usually the first point of call when the client shows up at the pharmacy. So they are very important members, critical members of the community pharmacy team. All right. And they are very, of course, unique and emotional human beings like us. They have a progressive mind. You have to see them in that view, in that perspective. But very importantly, they are custodians of 4 unique sets of value that we provide in the community pharmacy. And these will form the basis of what we'll be discussing tonight. So they form the products sales team, right? They are the ones who dispense these products and obtain the financial value for this product. They are our salesmen. They are our salesmen, right? They are our service delivery personnel. They are our service personnel. They deliver a set of services that we have in the pharmacy. So you want to know, what are the products that these guys will easily be skilled in or skilled at to deliver? You want to know what kind of services can you, invest, can you trust them to deliver with minimal experience, without pharmacy school experience. These guys are the custodian of number 3, the customer service. They must be well grounded in customer service. And of course, they play administrative and managerial role. Management services and admin are also part of what they do. So you need to understand these 4 categories of work that they do. I call it the unique sets of value that they give in the workplace for you to get the best out of them. So that broad class of areas of attention we need to focus on when we are trying to get our team on board. You need to look at them as product salespersons. You need to look at them as service providers. You need to look at them as customer service professionals, and you need to look at them as administrative officers and managers, right? So we go to the first one. So as product salesman, you want to look at a couple of things that you must ensure that they help you to drive, the value that they help you to drive, right? So number 1, you want to look at getting them to ensure product availability. All right. So you want to get them, they don't need any special pharmacy knowledge to ensure that certain products that are in demand are readily available, right? This comes from a place of having to make sure that you have a system for making the OS books, steadily updated and on time, right? And even when you're, looking at procurement, you ensure that, you have the right quantities available and you can forecast properly and know what to buy for a period of time. So this is simply something that you can get your team to put in place even without pharmacy experience, right? They can do this by simple study, data capture, and proper record keeping. They can get these values, right? So you can use them to ensure that there is product availability, right? You can use them to build sales relationships, right? Very important for marketing, right? You need to get them to understand that you need to create relationships with staff, with the customers, with the clients, right? And this comes from carefully and cautiously obtaining patient data as much as possible, right? Making sure that they understand the whole discount issue process and ensure that they do things that bring these people, make every client that comes have a very good time. You teach them how to cold call, how to reach out to people that you have no prior business relationship with, to get them to see and know that you exist and that you have some service that you render, that you have some product that you render. You need to get them to know that that's cold calling when you have no previous relationship, no previous interaction with this client, right? But warm calling is when you've had a previous, interaction, you've had a previous encounter with this customer, with this client, with this potential client, and you're trying to let them know, hey guys, I still exist. We still have some beautiful products for you, right? So that's warm calling. So these are some of the things you can get your team to be doing, because every day is for marketing. And then when sales come, you appreciate them and make the best out of it. But whether there is sales or not, marketing continues. Marketing is an everyday thing. No matter the business you're doing, there must be a marketing plan, on ground, right? So you need to teach your team to be empathic, right? They need to have empathy, right? They need to put themselves in the customer's shoe at all times. The client that is coming to the pharmacy, what is he expecting? What is she expecting? What are their expectations, right? You need to put yourself, what are the kind of things they expect to see? You need to let them know that, yeah, the client that comes here wants to see a clean shelf, wants to see products available, wants to be attended in the most courteous way, wants to be given an amazing experience when they show up, right? So you need to get them to be empathic. You need them to know that the customer wants assurance of confidentiality, right? They need to know that. And they need to also be so sensitive to the customer's needs, the customer's thoughts, and unravel their unspoken needs. It's not everything the customer will let you know. It's not everything that the client will let you know. You need to unravel these things and serve the client. That's what makes you a professional. You don't need to be a pharmacist. For example, someone who is coming and the person has flu, right? Or this person is coming looking so tired. You need to expect that, okay, this person has a very busy work schedule. And you need to ask this person, do you really have some good sleep? Maybe the person just came for malaria drugs, but you need to ask the person, I hope you're having some good sleep. And if you're not having good sleep, maybe a dose of melatonin, a melatonin supplement could be good. That way you move from the anti-malaria to something else that the client needs. And surely, in most cases, you find out that you're unraveling a need that they didn't even talk about. And that is where they begin to see you as a real professional, right? So we talk about the fourth one, the upselling and cross-selling. So these are things that, when you get your staff on board, you're able to let them know the branded products and the other generic products from other brands. You let them know the premium products, and they're able to upsell whenever there is need. And then you teach them to cross-sell. Okay, so if this client is asking for this, there is a tendency that they need this, these other products. There are products that are related. A client who is buying a pack of condom probably will need some lubricant, right? A client that is buying ORS obviously needs zinc, right? And perhaps you can also even add some probiotic. A client that is heavily dosed on antibiotics will probably need some probiotic. And most times when you suggest a probiotic to them, they are very excited and they are willing to pick it. So that's cross-selling, adding some things to increase the bag, the cart, the shopping bag, right? All for the good of the customer, not to exploit the customer, but to be able to help them meet other needs that they do not know that they have, right? And then negotiate for wins is another fifth item under embracing the excellent salesmanship. Sometimes you look at this product, well, this product has not been purchased, has not been purchased by any client for a long time, right? And then we're looking at the fact that this customer is negotiating, below the sales price. But then again, you can negotiate with this customer just to ensure that you liquidate that product. But you may not, definitely you're not going to hit less than the cost price, but you probably be able to, sell this product for something even greater than the cost price, but less than the selling price. All in a bid to make sure that you are able to reach a deal, right? So this is what I call negotiating for wins. So these things can be done in certain areas, certain categories of products, like the multivitamins and nutritional supplements. These are OTC products that can easily be dispensed by, your healthcare assistant, not necessarily by a pharmacist. Anti-malarials are there. Gastrointestinal preparation like antacid, anti-ulcer, anti-helminthics. They are also wonderful categories of products where your healthcare assistant can show excellent salesmanship, right? Reproductive health products are also products like contraceptives, lubes. These are products that they can actually sell out there and make, create real value. Analgesics and non-drug approaches to pain can also be areas of value, right? So you look at these are in terms of the areas of products. Now look at your healthcare assistant as a service provider. There are services that actually add value, right? That they may not even be requested for, but the fact that you're offering these services makes the client feel good, makes the client feel, yeah, that I'm in the right place where they really care about me and they're not just after my money. So you can train your healthcare assistants to, check blood pressure for clients who come talking about stress, right? Clients who are above 40, 45, 50, just do random blood pressure checks for them. In many pharmacies, it's free. Blood glucose checks for customers who are complaining that they are weeing a lot, they are feeling thirsty, they are even feeling erectile dysfunction. You can also check customers who are on the big side, taking us back to body mass index. When you see a customer that is on the big side and is complaining of certain things, you can also use that opportunity. Okay, let's just do a random blood sugar, or we can check your sugar level tomorrow. So these are things you can suggest. The other point of care tests that you can train your healthcare assistants to know how to do, like ARV test, pregnancy test, hepatitis, prostate specific antigen, and typhoid. We have point of care tests thanks to some of them from Health Check, right? Health Check brand of products, and I know there are so many other, point of care test strips and test care devices out there. Vaccine administrations can also be something that your healthcare assistants can give, especially if they are licensed community health extension workers. They are licensed to give in certain kinds of injections, injectables, IV and IM as well. And even IUD, intrauterine device installation, some healthcare assistants can be trained to be able to administer that as a contraceptive. So these are wonderful services that our healthcare assistants can actually provide. And trust me, they will be sending out amazing impressions in the eyes of your clients and potential clients as service providers and as members of the clinical team. And then you look at the area of customer service excellence. It's really a very broad area, but one thing that you need to know that your staff needs to embrace: smiling, warm welcome, proper salutations and farewell. Welcome your clients in the name of your pharmacy. Welcome to XYZ Pharmacy. And when you're going, thank you for patronizing us. Do have a healthy day. Do have a healthy week, right? Telephony, very important. Your client, your healthcare assistant need to know how to take phone calls. All right. Hello, good morning. You are on to XYZ Pharmacy. My name is this. So. How can I help you? How can I be of help? Right. And when they say all that they want to say, you're asking them, if I heard you right, madam, you said this, right? Okay. And then they provide solutions. And the ones they cannot provide solutions, they also make referrals, right? To maybe the pharmacist and all that. And when you finish, you also confirm, is that all you want us to do for you at this time? They say yes. Okay, so thank you so much for calling and do have a wonderful day. Should you have any other need, you can always call us. We'll be here to attend to you. Thank you so much for the call. Beautiful interactions, and the client is very happy. Not calling you and you're like, answering as though that the client is disturbing your peace. So we need to teach our staff, because they represent you. They are an important part of our PR team. They represent us out there, even when we are not around. For the bulk of the time, the healthcare assistant is out there. And then we must teach our healthcare assistants as customer service excellent persons to apologize for inability to meet expectations. When the client shows up and is asking for a medication and we don't have it, whether we've never sold it for 1 year, the client coming to the pharmacy expects that you have any medication. That's why you're a pharmacist. That's why you're a pharmacy, right? So it's important that you apologize. And even when they have made purchases, they expect you to give them balance when they've given you more than what they purchased. And when you don't have this, you owe them that apology. So you owe them apology for not having the balance. You owe them apology for not having a certain product. And you show effort, concise, sincere effort to meet those expectations. And like I always say, not just to meet the expectation, but to exceed the expectations, right? So this is part of customer excellence. You always try to exceed the expectations of the client. And wherever there is a conflict, don't feel overburdened. Don't feel that the customer is disturbing you. No matter your emotions, you must control yourself. You must make sure that you address conflicts promptly. You must ensure that you attend to the customer in the way that you would have felt if you were in that shoe, right? So it's important to address conflicts promptly. And there's so many other things under customer service excellence, but these, I've said, are very important areas that healthcare assistants must pay priority attention. And then again, you now look at administrative and management services. Finally, right? It is important that we encourage our staff to embrace self-development. Remember, and we support them as well when they do that, because the more they develop themselves, the more they acquire greater skill and competence to deliver value at the workplace, right? And they can do this by learning through trainings, through personal study. We must always create that chance for them to be able to develop themselves, sponsor them in trainings, and even when we're not sponsoring them, encourage them to also look at trainings and personal study, give them assignments, ensure that they're always on their toes trying to improve themselves. That way you see it rub off positively at the workplace, right? Get them to always keep records of footfalls, expiries, short-dated products, clients' records, sales expenses, deposits, payments, utilities, out of stock, etc. These are very important records that our staff must be keeping. Very, very important, non-negotiable. They must be keeping these records, because these are the things that help you know how well you're doing in business. As an employer, as a manager, as the owner of the business, you need these records every time, right? And when they keep these records, it takes us to the next thing. It's constant sending of reports. At the end of the month, when activities are carried out, encourage your staff to send reports. They may not be good at it at the first time, but when they keep doing it, they keep getting better. When you do this, you see them becoming better versions of themselves than they were when they started working at your place. And when they look back at their journey, they will say, I'm grateful I joined this team, I enjoyed this pharmacy, and this pharmacy has made me better than I was 10 months ago when I joined, so months ago when I joined. Get them to minimize losses by checking expiries, wastage, pilferages. Ensure you block these holes. Ensure you're always looking out for this. Ensure they see the importance of minimizing losses. This is an administrative and management service that your healthcare assistant can provide. Very importantly. And then when we look at the inventory, they must always track the stock levels. You must have a system to track stock levels. Very important and non-negotiable, right? And then procurement, you must teach them to procure smartly to meet the needs and not to just put products out there and tie down funds. Very, very important. Inventory and procurement are areas that you don't need so much expertise, but you can get them, train them to understand the dynamics of, stock out and stocking, and be able to know the stock levels and to be able to forecast and to make sure that you have what you need at all times, so that we don't fall short of the expectations of the clients when they come. All right. So it's important that we take note that product sales professionalism, our healthcare assistants are product sales persons, as service providers, as customer service excellent personnel and customer service providers, and of course, as administrative and management service professionals. We must get them to be on the same page, to be exceptional in this area. And when they do, you can be sure that you're doing so well. What are the desirable traits of an excellent healthcare assistant? When you're recruiting and when you're training them and when you're hiring, you must look out for integrity. They must be taught the importance of integrity, being able to put your eyes down, being tactful, being obedient, being committed to self-development, being proper time managers, being disciplined, being ability to take action always. And of course, you must teach them the importance of emotional intelligence. And if you're a healthcare assistant watching, you must embrace these desirable traits to be the best of your kind in the work you do. There are no negotiations about it. You can do this and more. This is not all, but these are important. From my own experience, from our work as management consultants, managing different pharmacies, these are some of the things we found out that healthcare assistant needs to imbibe in them to be the best. We see a lot of extraordinary healthcare assistants, and we can have much more if only we embrace these desirable traits. All right. So it's important that we look at these things that make for a very wonderful healthcare assistant. And as employers, it is important that we use these lessons to get the best of our healthcare assistant. And as we do this, no doubt our businesses will get the better for it, and our practice will be more and more fulfilling, and we will be able to make the best out of our practice, and it will be richly rewarding, and our practice will be profitable, and will become stars, and we will no longer have to bother about certain kinds of competitors that should not even match us at any level. So I wish you all the best, and I hope you've learned something amazing in this presentation today. I'll see you next week again for another episode of the Community Pharmacy Accelerator Show. Right? So you can drop a comment on the comment section. Is there any way we can improve on our delivery? We hope our lessons are gainful and meaningful, and it's been a blessing to the viewers. Thank you once again. My name is MC, Pharmacist Joseph, also known as MC Dr. Spice. And of course, it's another episode of the Community Pharmacy Accelerator Show, brought to you by PGNB's Consult. And I'll see you next week. Until then, have a wonderful week, and God bless you.